62 cases just yesterday, and that's a really high number of cases. Lagos was leading, followed by the FCT. Kaduna also had a large number. Okay, the number is 1,664 new cases, with Lagos reporting 642, FCT 407, Plateau 160, and trailing behind the third highest number is Kaduna with 83 cases. And well, this morning we would be discussing, the COVID-19 situation in Kaduna State with Dr. Jimoh Ibrahim. Good morning, and thank you for joining us.
Good morning, listeners.
Well, COVID-19 has been around with us for a couple of months now, for several months, I would say, from February 2020, and now we are in January 2021. By next month, it would be almost a year since we've had COVID-19 in Nigeria. Now, looking at the situation, we see the second wave has, what we call the second wave is what we're experiencing now, and the numbers are also increasing in Nigeria. 1,664 is a large number in one day. What is the current situation, and how do you, as medical practitioners, see this situation?
Thank you very much. The second wave is happening all over the world, so Nigeria is not an exemption. And as a result, it seems this second wave is associated with a high virulence, high pathogenicities, and associated with a high morbidity and mortality. So that is the features we are seeing in this second wave. So people need to be more cautious and follow all the guidelines and procedures laid down by health practitioners on how to prevent COVID-19. So COVID-19 is real. People should realize that, and we must learn how to live with it by adopting these preventive measures so that we can carry on with our lives, because it's not likely to go very soon, even despite the fact that the vaccines have been discovered.
Well, with the vaccine, well, Nigeria is expecting, about 42 million of that vaccine, and that's said to be the number that can cater for just about 20% of the Nigerian population. If that's the case, it means that the larger number of our population would be left out in this first phase of vaccination. And seeing as how normally it begins with the front people in the front lines, people like you who are doctors and all, before it gets to the masses, what are the possible ways that we can stay above this virus, stay at top of this virus, even before the general mass or the general population can get the vaccine?
Yes, thank you very much. This important question. The only way we can be above the virus is to follow all these laid down guidelines. Even with the existence of vaccines, we still need to be observing physical distance, avoid crowd as much as possible, regular hand washing with soap and water, or where there's no water, you can use alcohol-based hand sanitizers, and use respiratory. Follow the procedure on respiratory hygiene, which when you are coughing, you cover your mouth with either the tissue paper or your elbow, so that you don't spread if at all you are carrier, you don't spread the vaccines to the environment, so as to protect people as much as. That is the only way. Even with the existence of vaccines, the only way out, we must learn how to adopt these preventive measures.
It's very important that we observe the preventive measures. But in the case where we see that, people maybe have to be forced to observe this, these protocols laid down, as we see it, the Kaduna State government is taking it serious now, the enforcement of the use of face masks and social distancing. But we also see people, in crowded places like the markets as well. What can we do to manage the number of people who go to the markets, and how do we make sure that these people, stay and observe all the protocols such as social distancing in the marketplace?
Yes, thank you. Even with the enforcement of use of face mask in the society by our government, if you even look at the way people are putting it, they are not properly putting it, and we must enlighten our people that it must be face mask, not nose mask, or chin mask. Some people will just hang it around the chin and be moving around. The moment you are in the crowd, please put it up properly so that you won't be discharging, if you are a carrier, you won't be discharging the virus from your nose or from your mouth, because you can easily discharge this virus whether you are sneezing, talking, or you are coughing. So if it's not properly put up, you can easily be discharging the virus. Or if somebody around the environment where you are not discharging the virus and you are not putting up your face mask, you can easily be infected. That is incest. So coming to the issue of markets, I think the market people need to organize themselves. I've said it in this place before. Market must organize in such a manner that some physical distance should be able to be observed when somebody come to buy something and at some people's shop, so that you don't get infected in the process. You must learn to live healthfully, so that you'll be able to carry on with your business. And you should avoid too large gathering at a place in the market. Market is an open place. You can easily, you can as well transfer your business without moving closer to each other.
Okay, the transport system or the transport sector is another aspect where we have an issue, because before now, during the lockdowns, or when we began to ease the lockdowns, it was people had to social distance in the bus. The buses didn't have to carry full load, but now we've seen that has returned fully. People sit, the buses carry 2 people in front and 4 on every row, and that's a lot of congestion. That's not being taken care of, and people are saying that and believing that maybe the virus isn't as deadly as people say it, or maybe we don't even have the virus as much, and that's one of the things that is fueling the disbelief, around the virus. How do you react to that?
Yes, it's a serious challenge, and then I think government need to do something about it. I think government has come up with a policy before concerning the number of people those buses can be carried, but I don't know why it's very difficult for the government to enforce it. Maybe because of the economic situation or high cost of the fuel that the buses are encountering. Maybe that is the reason, but we must know that we have to be alive to do our business, and I want to appeal to the bus drivers to make sure to follow this COVID-19. Make sure those that you are carrying in your buses wear face mask. They should be able to enforce that. And concerning the reality of COVID-19, please, people should know that COVID-19 is real. I want to advise you to go and watch this viral video made by Alibaba, who was a victim. And you could see, in fact, it was practically causing those people that still don't believe the existence of COVID-19 in Nigeria because of what he went through. He said they used about 8 cylinders of oxygen before he could survive. So this thing is very real. It's a viral video going on in the online, so you can easily go and look for it, so that when you hear, and this is a comedian, he's not a government agent that you think that can be misleading the public. He's telling us his experience, what he encountered when he was in isolation. So this thing is very real. People are dying silently, so don't wait until you are infected, until your family is involved before you accept the reality that the COVID-19 is real. It's very serious, and the cases are rising daily. We have over 94,000 infected people in Nigeria as of midnight yesterday, and over 1,300 people have died. So this thing is kept on ravaging, and is spreading fast like a wildfire.
Now let's talk about the new strain, as we see it, reported in the United Kingdom and some parts of the United States and South Africa as well. The new strain is said to be more transmissible, and with that, could that be the reason why we're saying this? Is there any proof that we may have have the new strain in Nigeria? And if that's the case, could that be the reason why we have this, increasing numbers by the day?
I think there's already an evidence that we are experiencing new strain in Nigeria, because if you see the rate at which this infection is going on and the severity of the infection, the rate at which people are coming down with the illness, is a new strain different from what we have been experiencing since April. So people should take it very serious, and even we are even worrying health system because of that, because even with the existence of vaccine, there's an evidence that South Africa variants are not susceptible to the control of this to the control of the virus by using this the new vaccine that have been discovered. So there could be another strain that will be resistant to this vaccine. We don't know. So people have to be very careful, observe these preventive measures, and follow the guidelines laid down by the National Task Force on COVID-19 in Nigeria.
Let's talk about testing. Testing is the only way that people can tell if they have COVID or not. Because we've seen people say, "Oh, I may have come down with COVID," when all they had was a common cold. The symptoms are like, but we don't see people going out so much to test. When they come down with symptoms similar, or when they present symptoms similar to COVID-19, we don't see them going out to test as much. And what's the reason for this, and how can we up the testing in Kaduna State as it is? We see the numbers that Lagos and the FCT is reporting. Could it be that the numbers may be a little low in Kaduna because we're not testing enough?
Yes, there's a clear evidence that we are not doing enough tests in Kaduna State, and even the Kaduna State Ministry of Health has realized that, and they've sent emissaries to all the 23 local governments to go and carry out the advocacy visit to the local government, to the district heads, to all the security agencies on how to even enforce the compliance of the COVID-19. This is currently what is going on as I'm speaking. So there's no doubt about that. We are not doing enough tests in Kaduna. So there's no doubt about it, and that's why we are having this small number of people that have been confirmed to be positive. So the more you do test, the more cases you find, because there's evidence already that there's ongoing community transmissions in our society. So please, people should come forward for this test. The test is free. Nobody is charging you. We are doing all the general hospitals in the whole states, in all the local government, including Barau Diko Teaching Hospital, where there are designated centers where you can easily walk in to go and carry out the test and go home. And as soon as you are positive, you'll be contacted immediately. You'll be contacted immediately to be moved to isolation center, so that you don't continue the spread of the infection in your family and in the community.
Well, testing is free. You can walk into those hospitals or the centers and get tested for free. That's key. So that in case you're worried about payments, it's free for Kaduna residents and indigents as it is. Now, we have seen situations where there's a certain level of, would I say, mistrust when it comes to the testing. I know some people would say, I don't want to test so that they don't transmit the virus to me, because, well, how do we trust, these testing kids? How, what do you call it now? What's the word for it? How good and safe are these testing kits?
The quality of the test.
Exactly.
Yes, there's quality assurance we are doing to make sure the test, there's no contaminations of the test we are carrying out, and that is why people are being trained daily and retrained to make sure that there's we don't mess things up before, and there are procedures we follow. Because number one, in order not to mess up the test, there's what you call a PIN number. There's no two people that can bear the same PIN number. We can have two people bearing the same name, but that PIN number, no two people can bear one number. That's why the PIN number, to avoid the mix-up in the process. And the lab is constantly being fumigated to avoid contaminations. So all these quality assurance stages are being followed to the latter to make sure the quality of the result is guaranteed. The result that are coming out whether you are confirmed or negative is of good quality. There's no doubt or adulteration in the test they are releasing to the society. So what I can assure you, and it's a very quality test. That is why we are not using this strip test that most of the countries are not, because we cannot guarantee the sensitivity and specificity of the result. But we are using this PCR, using the PCR machine, which is highly specific for COVID-19 and is of high quality. And that is why we can guarantee the result we are releasing to the society.
Well, I've heard people complain about the fact that there's no serious contact tracing done when a person tests positive for COVID-19. How can you debunk this or prove it?
Yes, honestly, we are facing a lot of problem when it comes to contact tracing, because number one, the person that is confirmed need to line list who has he had contact with in the first case. So if the guy want to be dubious or he doesn't want to be straight, he can be misleading and give us an erroneous list of people, or reduce the number of people because of fear. Because we have the experience where some people will mention somebody and say, no, I've never had contact with that particular person, and this kind of thing is giving us headache. So please, if you are line listed to have had contact with anybody with COVID-19, please cooperate. We are just going to text you to make sure you are free of COVID, because you can be you can be carry the virus around without knowing, and you can be continue to infect others. So therefore, we are appealing to our people to comply, and appealing to those that are positive to give the honest list of people that they have contact with. And number one, people we normally line list when you are positive is your family. Then we also, do you go to market? Do you move from one area to another? Which kind of bus do you follow? At times it's very difficult to trace some people, because if you follow a public bus, it will be very difficult to track that kind of bus and know the number of people that were in that box at the same time, to be able to trace their address. And this is kind of thing that is aiding the spread of the virus in the communities. So people should learn to come forward and doing this test. Contact tracing alone cannot reveal. It only helps to reduce the number of the people that are infected in the community, because by being able to identify those that have contact, there are some people you will not be able to identify. Thank you very much.
Okay, so this is one very important aspect of the prevention of COVID-19. The fact that people should not, shake hands, do not hug, maintain distance. When you have to, exchange pleasantries, there's no need to hug. But we still see that, and it seems like people are forgetting that handshakes and hugs, are one of the easiest ways to transmit this virus. I think we need to resound that and get that into people, or drum it into the ears of people, that handshakes, because you see a situation where somebody presents his hand for a handshake and then you tell them I don't, and they get offended because because of that. Have you had this experience? And maybe you want to admonish people?
Yes, even in everywhere now you still see people having handshake, which is very, very unfortunate in this situation we find ourselves, because anybody carry the virus can easily contaminate his or her hands. That's what people should know, because you can easily contaminate your hand by when somebody cough, or you touch any objects where an infected person has stayed. You can easily, because when you sneeze this out, it comes down to as a droplet, and can easily contaminate tables or chair, even the wall. So when you move around yourself, touching all these places, you can easily get infected. And it's by constantly washing of hand, you can wash away this virus. Then if person's hands is infected, you should please avoid handshaking. That's why we are asking people not to be shaking hand. If at all you must, you still want to shake, you can use your elbow to touch each other, or use your foot to shake other, so as to avoid spreading this virus. So the virus can be on the hand. People should avoid handshaking as much as possible.
Yes, people still go out these days, and social gatherings and all. Even in some religious gatherings, it is hard to enforce the social distancing, the social distance protocol. If that's the case, what are our religious leaders doing to ensure that? Do you, layers as a committee, do you interact with religious leaders to ensure that we keep these numbers low? As low as possible.
Yes, these are important people in the society where we have been relating with on the importance on how to prevent this COVID-19, and they have been properly briefed and guided on how to make their religious service or activities very brief, so that even when you gather in the mosque, you can still maintain social distance and make it very brief as much as possible. So that when you make it very brief, the process of transmissions of virus can be limited as much as possible. Then wear your face mask even when you are in the mosque or in the church is very, very important. Avoid large crowd at a time, maintain social distance, and you can conduct as much service as frequently as possible in a day instead of guarding large crowd at the same time to conduct service. So please, we are religious leaders. We are appealing to you to help the government to help us spread these informations on how to prevent this COVID-19, so that the society will be better for it, so that we can move on with our life. Because we don't know when this COVID-19 will end, even with the existence of vaccine. That is the truth. Because the thing is still ravaging all over the world. Even the developed world that they started immunizing themselves. America is the epicenter of this COVID-19 in the world. They have about 21 million people have been infected, and over 365,000 have died. Followed by India is the second, with over 10 million have been infected. About 150,000 people have died. South Africa is the epicenter in Africa, where about 1.1 million have been infected, and there are over 30,000 people have died. So we are very lucky in Nigeria that we have about, as of last night, we have over 94,000 people. We are approaching 100,000. You can remember about a few months back, we just had about 1,000, 2,000. Now we are 94, and about 1,300 people have died. So people are dying daily in silence. We don't know. So please, let's cooperate with the government, follow these policies so that we can carry on with our lives.
The program is Perspectives on Invicta 98.9. We have been discussing the COVID-19 situation in Kaduna State with Dr. Jimoh Ibrahim. Stay with us. We'll be back after this commercial pause.
Invicta FM.
Thank you for remaining with us. The program is still Perspectives on Invicta 98.9, and we have been talking or discussing the COVID-19 situation in Kaduna State with Dr. Jimoh Ibrahim, who is a consultant public health physician with Barrow Dikko Specialist Hospital in the Department of Community Medicine. He is a member of Rapid Response Team on COVID-19 in Kaduna State, battling with the COVID-19 since April 2020. It's quite unfortunate that we have to deal with all of this. As a frontliner, what would you say your experience has been, Dr. Jimoh, for those who may be wondering?
Yeah, thank you very much. It has been up and down. Some of us have been infected during the course of this COVID-19. I must confess, once time being infected, and I recover from it. So having COVID-19 is not a death sentence. You have over 80% of those that carry the virus are asymptomatic, telling you that the virus is not as fatal as one may be thinking. But that is not to say it cannot kill, because there are some people that have high risk that can easily be susceptible to the pathogenicity of the virus. So as a result of that, people should be very careful. So it's not a death sentence. People should come forward, take the test as much as possible. Because we are frontline, we frequently take these tests. But so far, I've taken more than 5 tests to tell you because as you are moving around in the community to convince people to come and taste this or do contact tracing, we may have contact even with people we may not know, and in the process we may get infected, and that is the reason why we serially take the test, and why we continue to take the test until probably when we get vaccinated. So that is the situation. That is our experience. It's not a simple. Some of our colleagues have died, even Kaduna here. So some people are not lucky. So that is why you don't know who could be. So that is why it's better to take preventive measures. They say prevention is better than cure. So it's better we take all these preventive measures so that we can carry on with our life and continue to do our activity. And that is probably the reason government don't want to do complete lockdown, because of the hunger in the society. Because going for lockdown is going to be suicidal, and the economy is in doldrum. We are in recession. So marry all these things together. That's why government is trying to see what can we do and to avoid lockdown so that people can go on with their economic activities.
Prevention is better than any medical intervention when it comes to COVID-19, as we have seen it. That's Dr. Jimoh Ibrahim narrating his personal experience. So there's nothing, it's not something to stigmatize people about. COVID-19 is not a death sentence. If you contract the virus, you most likely would recover from it, just like you've heard from Dr. Jimoh Ibrahim. Would want to bring you into the conversation now. The numbers to call are 081 40,000 989. That is 081 40,000 989 and 070 87 800 989. That is 070 87 800 989. Remember, it's about you, it's about me, it's about our community and how we can stay safe from the virus. Hello, good morning.
Hello, good morning, Prince.
Good morning. Thank you for joining us.
And good morning to the doctor.
Good morning, sir.
My name is Comrade Gabriel, the Texas man.
Go ahead.
In fact, as the Waka Waka ambassador, I took the train from Refinery Junction here to Sabo. I said, why are you carrying for? They say, if I don't want Intermaka, come down. I took a bus from Sabo to the township. In fact, they carried 10. When I say why, they say, if I don't want Maka, just come down. I took it also to Kao, they still carry the same 10. So when I was coming back to Refinery Junction here, I took the one from Refinery, the one that used to load Refinery. In fact, those people obey. They carry only 5 people with a driver, no conductor. So, but what they did is that instead of charging 100 naira, they took 200 naira. But I think it's also safe. Secondly, sir, I was at Sabo General Hospital. In fact, there's no social distance there. That is the truth. Where we are currently waiting for doctors, people choke up. Okay. At least less than 50% of people even wear face masks. So the government should also look at her own institution. Also, it's very, very important. Right from the gate, and make sure that as an ambassador, I go around and make sure that place that they used to sit down and wait for the doctor, in fact, it was choke up. So I don't know why. So I think the government needs to do more on her own side also, while we also were banned. And those of us listening to Indita, we are safe, because Indita at any program, from the beginning to the end, they always make sure this COVID-19. So we appreciate the Kaduna State Governor and Indita for all their efforts. Thank you, sir.
Thank you very much, Comrade Gabriel. We'll take another call and get back to Doctor. Hello, good morning.
Good morning, sir.
Welcome to
Yes,
Perspectives.
Sir.
What's your name?
Good morning to you, guest. This is Joseph from Goningora.
Joseph from Goningora. Go ahead, let's hear you.
I just want to get something, although I tuned to the station late. I don't know whether it was talked about. The COVID-19 of a thing. Is it the virus that actually do the damage, or it just weakens the immune system? Then other issues like malaria, maybe other ailments come in and then perform the damages, or it's the virus itself. Now, if it's not the virus itself that does that, all the virus does is just to weaken the immune system, then other stuff do whatever they need to do. I'm saying, is it not better to focus on getting every individual aware of the fact that when it comes to malaria, ensure that you avoid malaria at all costs or by all means. Your environment should be clean. This should be done. If you have issues that maybe other kind of I don't know how to put it, diseases that may just ensure that other aspects are being prevented and your immune system is high, you eat good food and stuff like that.
All right.
Because even the prevention, sometimes no matter how you prevent wear this stuff, yes, it's very good, but you may get it. But when it is gotten, is it actually the virus that kill or just weaken the immune system?
All right, thank you.
That's just what I want to
Joseph Bonigora, thank you for that question that you just asked. We'll take one more before we go to Dr. Jamal. Hello, good morning.
Hello, good morning.
Thank you for joining us. What's your name, sir?
Thank you. I'm Isaac calling from Idimusa Mando.
Okay.
Thank you. Well, I will recommend the Kaduna State government for informing people to be very well aware of this coronavirus. Because based on publicity, yes, they have tried. But the compliance from the citizens, which is very low and not encouraging. My advice to the government, they started going street by street in some area of Kaduna State, arresting with mobile court, arresting those that are not complying. But the question goes like this: if they are doing that, what are they going to do about the government gathering that they are doing without observing the protocol? Example, for the late Emir of Zazo, we look at the crowdly people they gather without observing the protocol. Is it not the one that is weakening the spirit of the citizen, thinking that this is problem? If them, one function or the other, they will gather without observing the protocol, then what about the people? They will treat it the same. So let the government first show example. Let them arrest even elites, those big people, so that they will prosecute when people are seeing. Then they will say, if they prosecute so Mr. A, why will I be scot-free? So I will hearken to the advice. I think it will help us so that we will not spread what will damage our own future.
All right.
Thank you.
Thank you very much, Asimadu. Dr. Ibrahim, you want to respond to some of this?
Yes, I want to thank you all for these important questions and contributions. Let me start from Comrade Gabriel. You talk of overcrowding. Why boarding the keke napep and other means of transporters? Yes, I think there's need for government to do more in terms of enforcement in this. People are very difficult to control, and I don't think it's very it will help us in the control of this COVID-19 if people continue to misbehave in this manner. Our law enforcement agents need to come harder more on these people to force them to, human beings, I don't know why people have to be on your neck before you do the right thing. Please let us do the right thing. You've raised pertinent questions, very germane, very important. I've also observed that, and I think governments, they are listening and they are likely to do something on that. Concerning the Sabo General Hospital waiting area being overcrowded, I'm going to personally take it up. I will contact my state epidemiologist to talk to the CMD of the place to do something. This is very unacceptable, and this is the campaign we have been doing. The health workers will be in the forefront to show people examples. So I don't know why this is still happening, but we will investigate and do something, and I must assure you, you will really see the difference very soon. Concerning the COVID-19, whether it's the virus that is doing the damage or is the immune system, I must tell you that COVID-19 is different from HIV. It's the HIV that reduce the immune system of individual, where other form of infections come in to kill the individual. But for COVID-19, it's the virus itself that is causing the damage. But the virus flourish well when the immune system of individual is compromised, like people with HIV, or you have chronic illness like diabetes, hypertension, or you have malnutrition. Because COVID-19 keep people through the respiratory system very fast. That is why because it causes respiratory embarrassment, and that is why they have to put people on oxygen or respirator, or at times take over the respiration when the people are seriously affected. So it's the virus that caused the damage, and not that is causing the compromising. Is compromising the immune system. No, it's the virus that's causing the problem. So for the poor compliance among citizens, we continue to sensitize the communities, and that is why we are on the radio to continue to mobilize. Do the campaign and sensitize and the community to comply. Then concerning the government, not observe or not be at the forefront or not be a good example. I think government is trying, but because there are certain things they are doing behind the scene that most people don't know, and I have been talking about this. There's a certain group of people among the response team. We call them risk communication team. In anything government functions that they want to do, they normally send this team as an advanced team. Number one, to screen people as they are entering. Number two, to arrange the sittings in a manner that certain physical distance will be observed, and to make sure certain group of people, probably their clothes must, to wear face masks. Government have been doing that, and they will continue to do that. Even if the high caliber people want to have marriage, or somebody want to have gathering somewhere, they normally instruct those risk communication team to go and take over the place, so that the COVID-19 protocols will be duly observed as much as possible. These are the things going behind the scene that we don't come out to say. But governance must continue. You can't ask governance to stop because we want to control COVID-19. Otherwise, all the economy, everything will collapse. People, government must pay salary. They must continue their construction. They must move around to inspect what the project they are doing. And when the governor move around, you come out with his entourage. You can't ask governor to go alone to go and inspect to inspect construction going on here and there because of COVID. Because governance must continue. But what is most important thing is how to learn to live with these preventive measures, so that everybody will be safe as much as possible.
It's important to learn to live with the preventive measures as much as possible. We'll take more calls now on the program Perspectives. We're talking COVID-19 situation in Kaduna State with Dr. Jimoh Ibrahim, who has also shared his experience with COVID-19 in Kaduna State. We're taking another call here. Hello, good morning.
Hello, good morning, Shaman from Angulus.
Shaman, thank you for joining us.
Yes, sir. The response has been so wonderful and expensive. If you go to these new registration points, honestly, you wonder what is happening in this country. Look at how people are queuing. Even if you are wearing face masks and your system is wet, you are touching the other opponent. Don't you think you can be transmitting this thing? For God's sake, why can't the government have a rethink over the issue of new registration, so that we'll be safe from this touch called coronavirus? Honestly, I'm bothered about the concept of Nigeria. They will not see us through in Jesus' name.
Thank you very much. Thank you for calling in. We're still taking more calls and, your thoughts, comments and suggestions and even questions as regards COVID-19 in Kaduna State and Nigeria in general. 081 42000 989 and 07087 800 989. Hello, good morning.
Good morning, sir.
Welcome to Perspectives.
My name is Buba Umar.
Buba Umar, thank you for joining us.
Yeah, and sir, when we talk about second wave, now contact tracing is paramount and important, because now we are not talking of isolation centers, but domesticating the pandemic. Now, it's most of your testing venues are more of strategic locations Why not demonstrate the testing case to public domicile so that accessibility would be very easy for those concerned? Thank you very much, sir.
Okay, thank you, Buba, for calling. Thank you so much. We appreciate your call and comment. Doctor, you want to respond to Shamang and Buba Omar, who were talking. Shamang was talking about the NIN registration, where people are, coming out in crowds and large numbers to get the registration done. He's saying, does it mean, is this the best time, and what can government do to maybe change the situation?
Yes, thank you very much. It's a very important questions, and it's a source of concern to all of us who are members of rapid response team. But what I just want to say here, I'm not speaking for the government, but it's like government is between Deep Blue Sea and devils, because they are trying to see we have serious challenge in the insecurities, and we have COVID-19 at the other hand ravaging the country. And based on the information we are hearing concerning why they give the deadline concerning this national identification numbers, is to be able to be ahead of this fighting on insecurity. And we must know that the governance have to continue. As I've said, you cannot abandon one for the others. In as much as government want to control this COVID-19, there are other problems. There's also a serious challenge. And health and security, I always say this, they are interwoven and related. And until we are able to battle this, the two at the same time, we may still have problem. But government come up with a policy, which I think if it is strictly adhered to, it will be able to control the crowd as much as possible. Is this booking system? They have been explaining it, but at times there's another way to come up with policy. The implementation may be faulty or not really being adhered to. If they follow that booking system, where individual is giving certain appointment, come so day within so time to take your biometry or what have you, I think that will reduce the crowd as much as possible. Because it's very, very important to control the crowd at this, so that it will not be a dissemination center where people go home with the COVID-19, then we go back to square one. So that all the effort we have been putting in place, struggling to control the virus, will not be in a futile exercise. I think that is government need to come up with a strong policy and implement it to the latter, so that the crowd can be controlled as much. I cannot ask government to stop it, because when they give their reasons, you listen to them. We have insecurity all over, and this name they are trying to come up with a part of the strategies they want to adopt in controlling, in fighting this insecurity. So that is what I can say concerning that. We continue to appeal to our people people at that registration center can also organize themselves. We know everybody want to change order short by shunting. That is not the best way to go. Let's organize. You can be on key and maintain certain distance and stop touching each other anyhow. Then Buba Umar talk a lot about contact tracing and not taking tests to community. We are still doing community testing, though it may not as rigorous as we are doing early. This thing is highly very costly to recruit people to move up and down. But we are still doing it because we have rapid response team that move from one area to another. But we decided to to designate these testing centers to make life easy. The program is very cost. It's very cost. And we are in economic recession. Government is trying to see how they can balance the situation. But some people can still go to those designated centers and take but occasionally we still move around the communities. But it may not as rigorous as it was when the COVID-19 just started, because it has been decentralized in all the 23 local governments. We have rapid response team. And to inform you about the evidence of people, when we are doing contact tracing, you don't stay in the hospital to do contact tracing. We go into community to capture all those, to track all those people, get them tested, and return back to our base. So we are still coming to the community, and if anybody still want to get tested. There's designated numbers, though I don't have it, to be called, so that we can help you. He said that we direct you to the nearest place if you don't know, or if you come to contact tracing around your area, we can also take your test.
All right, let's take one more call. Hello, good morning.
Hello, good morning.
Good morning. Welcome to Perspectives. What's your name?
Thank you very much. My name is David, calling from Kidele.
David, go ahead. Let's hear you.
Yeah, I would like to put this question to doctor. Before the outbreak of coronavirus, there are illnesses like this common cold, catarrh, and headache and cough. Why is it that when somebody goes to hospital these days, they ascribe these things to coronavirus? And lastly, there are many things that government needs to look into. The evidence overflow on this coronavirus. They should adopt better measures to alleviate poverty. I'm not saying coronavirus is very easy, but the government should look at other things, not to always overflow the try to emphasize on coronavirus. Thank you very much.
Thank you. That's your concern there. Doctor, I don't know how you want to respond to that. He says you go to the hospitals and they ascribe everything to COVID-19, and then, well, I don't see the need why government should not emphasize and continue to emphasize the need for people to stay safe. It's very important. That's one of the responsibilities of government. Doctor, please respond to that.
Yes, thank you very much, Mr. David. But what you must know that most of the symptoms we see on COVID-19 is also similar with other illnesses. So it will be very difficult for us to, as a health workers, to identify whether you have COVID-19 or not until you do test. So you can come with all sort of symptoms, and you can only confirm illnesses by doing tests. And the health workers too need to protect themselves. We are being infected daily at our health facilities. So we want to protect ourselves, that because the way we interact with you, the way we move closer to you if you are negative, is different from those that carry the virus. And that is the why when you come down with those symptoms, the suggestion we normally give, please go and take COVID-19 test first. So when you are confirmed negative, it's not that even if you come down positive, we will not attend to you. But there are certain gadgets we need to put on to attend to you, so that we will not be get infected in the process. Probably that is the reason why the health workers are doing that. And people should bear with us. Do this test. They said the test is free. If you are going to do malaria test, you must pay. You want to do typhoid test, you must pay. And there's a test that is free near you. You are complaining about it. Please, people should come forward to do this, to do test. So concerning the overflogging of COVID-19, I don't think, if you see the data I've given before, say COVID-19 is real, and it can further improvise you. You can further be put into poverty if you are sick, because it's only healthy people that can move around to work. And that is why government is putting emphasis on this COVID-19, so that you can be taken out of poverty. They are all interwoven, because it's only the healthy people that can go and work. Thank you very much.
Right, this is where we will close the program. One of the fundamental pillars of human capital development is health, and it's very fundamental that government maintains that and makes sure that its citizenry is healthy. This has been the program Perspectives today. We discussed a COVID-19 situation in Kaduna State with Dr. Jimoh Ibrahim, consultant public health physician, Barrow Diko Specialist Hospital, Department of Community Medicine, member rapid response team on COVID-19 in Kaduna State. Thank you so much for sharing time with us today, sir.
It's my pleasure.
All right, this is where we close the program Perspectives today. Go do well, observe social distancing, wash your hands as regular as possible, eat good food and stay healthy. It's been Perspectives. My name is Ihia Nacho Prince. Thank you for staying with us. Perspectives will come back tomorrow at 9 o'clock. Bye for now.